So see this openings, minute openings on the inside. So this is another specimen. See the right atrium here. So along this sulcus it has been opened. So we see these minute openings here. This is the openings of the vena cordis minimarum. You can see lots of them. And other than vena cordis minimi, so we have the openings of anterior cardiac vein also into the right atrium. The other opening we find here inside the right atrium is the opening of the coronary sinus. This is the opening of the coronary sinus. The coronary sinus is present at the crux. This is the crux where you have the posterior part of the interatrial and the posterior interventricular joining the posterior part of atrioventricular sulcus. So this is the crux. At the crux we have the coronary sinus. So its opening can be seen on the inside of the right atrium. So this opening here is the opening of the coronary sinus. The opening of the coronary sinus is just at the inferior vena cava, the opening of the inferior, close to the opening of the inferior vena cava. As you can see, this is where you have the inferior vena caval opening. So between it and the septal wall we have the opening of the coronary sinus. The coronary sinus is guarded by a rudimentary valve that is called the Thebesian valve. The Thebesian valve, it is also formed by the reduplication of the endocardium. So it's the opening of coronary sinus. Okay. The other opening that we find here, an important opening, is the atrioventricular orifice. This is the atrioventricular orifice. So we will discuss the atrioventricular orifice with the ventricle, the right ventricle. So this is the right atrioventricular orifice. So these are the openings. So this right atrioventricular orifice communicates the right atrium with the right ventricle. So this is the right ventricle here. So the communication right atrium to the right ventricle is through this opening, that is the right atrioventricular orifice or the tricuspid valve or orifice. Now the other features that we find here is along the septal wall, that is between the right and left atrial walls. The left atrium, the right atrium. So here we have the septa, interatrial septa. So the other features on the inside of the right atrium can be found along the atrial septa. So what are these features? So here, so I think it is better to continue with this specimen because this is already washed. This requires a wash because we just removed the clot from it. Okay, alright, so now we'll continue with this specimen here. So when you open up in the septal wall, that is between the right atrium and left atrial wall, we find certain important features. So first feature you find here is the fossa ovalis. Okay, so what is this fossa ovalis? This opening here, it is not an opening, it is just a depression. So I think so it is better to show in another specimen because it is cut very close to the fossa ovalis. See if any other specimen is available, or else we'll divide this, cut open this specimen along the same landmark, the sulcus terminalis. Yes, so here on the close to the septal wall, the opening of the superior vena cava. So over here we have this fossa ovalis. So it is an oval fossa. Okay, it is an oval fossa which can accommodate, is like this. This is the oval fossa. Okay, just somewhat oval shaped depression. This is called the fossa ovalis. Okay, here also you can see this is the fossa ovalis. This depression here is the fossa ovalis. This fossa ovalis is actually derived from the septum primum. So along the upper margin of the fossa ovalis there is another feature that is called limbus fossa ovalis. This is the limbus fossa ovalis, that is a somewhat semi-lunar shaped margin called the limbus fossa ovalis. Okay. Now, what are the other features we find here? Above the fossa ovalis, here we find an elevation. It is not seen, but it can be felt. This elevation is called the torus aorticus. So it's a small elevation. This is the torus aorticus. What is torus aorticus? Torus aorticus is actually a projection of the non-coronary sinus of the ascending aorta. See, this is the ascending aorta. The ascending aorta, see this specimen here. See the apex, the right atrium. Okay, right atrium. On the interatrial septal wall, we have the fossa ovalis, then we have the limbus fossa ovalis. The third feature I mentioned is the torus aorticus. So what is torus aorticus? Torus aorticus is a small projection on the inside of the right atrium that is due to the non-coronary sinus. I will tell you what non-coronary sinus is. So this is the ascending aorta. Okay, ascending aorta, it has been cut here in order to expose its valves and sinuses. See here, this is the right coronary artery, and here is the left coronary artery. Okay, so as you know that the coronary arteries arise from the coronary sinuses. So this is the opening of the aorta, and on the inside we see the valves of the aorta. These are the semilunar valves. 3 cusps are there. Okay, 3 cusps are there. So here on the above the cusp there is a space called sinus. So from the sinus we have the coronary arteries arising. So the right coronary artery arises from the anterior aortic sinus. So this is the right coronary artery, stem of the main part of the right coronary artery. So here you can see this opening. This is the opening of the right coronary artery, this one. So you can follow it into the right coronary artery, this one. So this is the right coronary artery arising from the anterior aortic sinus. Okay, so here is the anterior aortic sinus. Then you have right and left posterior aortic sinuses. This is the right posterior aortic sinus, this is the left posterior aortic sinus with anatomical position, the one that is present anteriorly. So this is anterior, this is posterior. Okay, anterior, posterior. So here is the anterior aortic sinus. From the anterior aortic sinus you have the right coronary artery. I showed you the opening of the right coronary artery, this one. And then you have two remaining, the right posterior aortic sinus and the left posterior aortic sinus. The left posterior aortic sinus gives rise to the origin of left coronary artery. So you have the left coronary artery here, the left coronary artery. The left coronary artery arises from the left posterior aortic sinus, this one. Okay, now right posterior aortic sinus is remaining, which is not going to give rise to any coronary artery because you have only 2 coronary arteries, right and left posterior, right and left coronary arteries. So the right posterior aortic sinus is non-coronary sinus. So this seen as a projection inside the right atrium, the right atrium. So this right posterior aortic sinus seen as a projection on the inside of the right atrium, that is called torus aorticus. So torus aorticus is the non-coronary sinus. Okay, the sinus inside the ascending aorta that does not give rise to coronary artery is called non-coronary sinus or the torus aorticus. So this non-coronary sinus is seen as a projection. This non-coronary sinus seen as a projection is called the torus aorticus, that's seen as a projection on the inside of the right atrium.